absolute favorites. Dr. Stephen Etheredge joins us now. Feels like old 6 to 8 radio.
Right,
old nighttime
right.
radio back in the day. A little hanging with Hester.
Yeah, we get a little weird at night, but this was like the one segment that gave us a little like legitimacy to like actually talking serious. So we're bringing it back to the mornings.
Might be giving me too much credit there.
But. No. All right.
You got doctor in front of your name, so yes, legitimacy.
So we obviously going to talk some injuries here with Dr. Etheredge, and like more than just like get into, okay, this guy and this injury, what's the timetable? Like just the injury itself is typically what we kind of get into there. So obviously there's, some Saints offensive linemen that are down. There's some Saints tight ends that are down right now. But okay, so turf toe is one of the things that is keeping a Saints offensive lineman out right now. And we were kind of joking because I had the same thought as you had growing up when Deion Sanders had turf toe. I remember hearing that as, 10-year-old, whatever it was. You're like, turf toe? Man, if I told my dad I can't go out there because I got turf toe, you know what he would say to me? What is turf toe? And like, how long is that recovery? And when you go out there, is it a situation where you can try to get back too soon and, just continue to hurt it?
Yeah, it's funny because, like you said, it's one of those things that just doesn't sound like a big deal. It's a toe injury. We don't think a whole lot about that. But when you're talking about a turf toe, it's specifically a big toe injury. So the great toe, the big toe. And sometimes they'll lump a few different diagnoses in that category. But technically, when we talk about a turf toe, it's an injury to what's called the plantar plate. So that's on the bottom of the toe. So it's the area right at the base of the big toe. And what happens is that toe gets hyperextended. So if your foot's kind of bent and you come down the front of that toe in that hyperextended position, especially if you have like all your weight come down on, or somebody falls on the back of your foot or falls on your body, you can sprain or even tear that ligamentous kind of capsule under the toe. And so then every time you try to push off, and as much as we don't think of toes as being that important, especially that big toe, if you think about how much with a sport you're up on your toes, right? You're pushing off everything you do that's explosive. So even as a lineman, when you're getting out of your stance, when you're having to kick step and come back and land on that toe in that bent position, every time you're hitting that tear, every time you're hitting that injury. So while it doesn't sound like it's that big of a deal, I mean, it can be excruciating and functionally very difficult.
Is it something that you can continue to like make worse? Or is it a pain? Is it a pain situation? Can you continue to just look every time you go out there, it just kind of hit reset?
Well, like a lot of injuries about severity. So turf toe, if you have a mild, kind of a grade 1, that's more of a sprain. That's you kind of stretch it, you kind of irritated it. Those are the injuries you can kind of play with. With those guys, we'll sometimes put like a carbon fiber insole in the shoe that gives a little more rigidity to the shoe, so there's a little bit less bend to that toe.
Right.
You can do the typical, therapy, anti-inflammatories, all the normal stuff that we do. And that, you can usually play through that. Now, when you start getting into grade 2, that's a partial tear. That's the one that, we might boot that guy for, anywhere from 4 to 6 weeks.
Oh, wow.
Kind of keeping them kind of, to let that heal. But those will heal. And then you can have a full tear. So if you push these guys back too early, you could tear it. Full tear is usually going to be surgery. So that's, potentially season ending if that's the case.
Can we come up with just a more better name for it? Like, because like what you're explaining here, it's like, that's like a torn tendon, like in the bottom of my foot at my big toe.
Right.
Let's just come up with like a little bit better name of it, more severe. They say like a torn Achilles or a torn ACL. Everyone's like, whoa, man, well, you say turf toe.
It does make it sound really bad, and I guess, you can always use fancier words, a sprain of the plate at the first, metatarsal phalanges.
Okay, turf toe.
If you want to get it. Yeah, exactly.
Never mind. I take it back.
Flows a little easier.
That's right. So,
but with a plantar, though, I don't know if you've ever had like plantar fasciitis. I've had that, and they're like, it's better to actually have that fully tear than maybe just have something partial that's going to continue to just, aggravate you. Like I actually heard mine pop whenever I did mine.
Plantar fascia, they just feel better when they tear. It's chronically inflamed and irritated. Plantar fascia, compared to the toe, because it's not quite as structurally significant. That big toe being able to flex and push off of it, if you have a complete disruption there, functionally you're going to be limited.
Oof, man. I want to talk about, we brought him up, you got a friend of the show here, and he will clap. So first preseason game, couple plays into the guy,
play.
An experienced vet, so excited to get back to New Orleans. So it's kind of heartbreaking to see him go down with an injury so fast in the first preseason game. So he has a Lisfranc injury in his right foot. Can you kind of explain what that is, from a medical standpoint, what a Lisfranc is, and what is actually tearing or breaking in the foot?
Yeah, so with Lisfranc, it's kind of fun because at least a little more mysterious name there. It's not quite as
It's a fun name. Yeah.
lame as a turf toe sounding it was. But so this is an injury more in the midfoot. So another foot injury. These are unfortunately not that uncommon in sports.
Right.
Typically, this is going to be a little bigger injury. I mean, there's all, again, degrees of severity. Is this just a mild Lisfranc sprain versus a complete disruption? But you have this area right at the base of your, what are called your metatarsals. So the metatarsals are the long bones in the foot. They're the bones that kind of go from the midfoot to the toe.
Yeah.
So we have one that basically lines up with each toe. So you have 5 metatarsal bones. And at the base of that second metatarsal, where it articulates with the rest of the foot, these smaller tarsal bones, you can have a disruption of a ligament there and potentially break the base of that second metatarsal. So Lisfranc injury is really some combination of one of those two things. There's a ligament and a bone, sometimes both, sometimes one. And just like we were talking about with the turf toe, if it's a mild sprain, that might be something that we can kind of boot up for a little bit. We can sort of work with it. But once you get a true disruption of the ligament, or if you have the fracture injury, that joint becomes unstable. And an unstable joint in a foot that's carrying all your weight, especially a big guy like Will, that's not a good injury. So that's usually going to be surgery. You're usually going to have to go restabilize, put a screw in, put some kind of a tight wire, depending on where the injury is, and then let that heal.
Man, you start talking about all the different injuries just in the foot alone.
I know, right?
And like how many different things can go wrong.
Yeah, I was about to ask you before, Lisfranc, is it a surgical situation? So you're talking, it could be, depending on the severity, plates, screws, things like that.
Right. And I'm not sure with Will's situation. I haven't heard the official, but if you hear he's out for the season, my assumption is more than likely he's getting that fixed.
Sure. All right, so ACL is something that we talk about probably more than any injury in sports. It's the ACL, and it's the how long is it going to take to get back. Now, obviously, if we were having this conversation 20 years ago, like we're not even really having it. It's like, nope, done, out, see ya, doesn't matter. It's going to be like a full calendar year, like 12 months, and we're talking maybe even longer than that. But now we're seeing guys come back, I think, much quicker from that injury. The Saints got a couple tight ends that are dealing with that they happened at the end of last year. Is it possible for them to have that in December, January, and then assume that they can help you out in September?
September's hard.
Yeah.
We've had guys probably kind of in that 8-ish month range, probably on the short end to make it back. That's where we are now. And like you said, that's much faster than what it used to be. But unfortunately, that's probably the shortest you're going to see. And for somebody to get back at that 8-month, it really needs to be a perfect case scenario, just an ACL injury, because sometimes when you damage the ACL, you can have meniscus and cartilage injuries with it. And everything that goes into that slows the recovery a little bit. And then you just got to really just have really good fortune. We're very lucky, with our athletes that we have so many resources. What we have today, even compared to a few years ago, let alone when y'all played or when I played, even which wasn't that long ago. The advances we have,
Thanks, appreciate it.
It's the rehab, it's the nutrition, it's knowledge, it's better surgical techniques. There's a lot of things that go into it, but unfortunately, you're still looking at several months. That the graft has to heal in. So when it's an ACL injury, you basically make a new ACL. It's not you don't go in and fix the old one. So that new ACL. Basically, we have to see it mature. We have to see the bone around it grow in. We have to see all that. Then you've got to get your muscle strength back. You got to be fairly symmetric to the other side. You got to have good balance, proprioception, and basically teach the body to use this new knee.
Right.
Because technically, it's not the same knee it was. So you have to kind of learn all that again. So that whole process takes months. And if you rush it, you're probably going to re-tear it and come back just weaker and not as functionally well. But again, re-injury is the big concern.
How has over the years, how often does that surgery for an ACL? Because I would say from season ending, it's like the most prevalent one for a season ending type injury. Like, what has all changed? Because I know there's been periods of time where it's like cadaver, there's been, you take hamstring muscle, like you take different things. So what is that grafting process now? Like, what are the specifics? Why it is so much better and faster now than it was, probably 5, 10, certainly 20 years ago?
Yeah, so some of it, like you said, there are different grafts. Most of the times we're using something from your own body. So you can use cadaver tendons and ligaments, but the problem with those is sometimes they're a little bit weaker. There's a little bit more risk that those may tear again in the future. So we find that if we're able to use your own body's tissue, we're able to do better. Usually that's coming from either your hamstring, the patellar tendon, or the quad tendon. Those are the big three that we're typically using. Talk to different guys. That's always a debate in our circles, which one's better, and there's some reasons why each one probably has favorability over the other. One might be a little more durable. One might get you back a little quicker. and we could sit here and have a whole scientific discussion on which is better that could last days and probably not determine it to everybody's satisfaction. But the reality of it is, what we found is that using your own tissue typically goes better. And then those techniques for how we get that, going in and harvesting it, because if we're taking a portion of your patellar tendon, well, not only does that ACL have to heal, but that patellar tendon has to heal. You might have patellar tendonitis problems down the road and things like that. So we got to be really careful with how we're harvesting it. But I think a lot of it is we've learned the perfect amount to take, the perfect place to put it. Where do you put the tunnel in the bone? There's so many different variables that go into it. And I think once we've kind of researched it and gone back and been critical of our own work, we've been able to get to a pretty good point. But it's still a hard surgery.
Mm-hmm.
Now, Dr. Etheredge, obviously, we can't talk LSU injuries, and that's the team that you work with there, and we're not going to get into any injury. I'll just ask you one question that I think you can answer. Have you ever had to explain what tendonitis was to more people over a short period of time?
Yeah, that's for some strange reason been an interesting topic lately. Tendonitis, and it's funny because in my clinic I tell patients tendonitis is one of the quote unquote weird problems. Because you doesn't, again, kind of like a turf toe, it doesn't sound that bad. It sounds like this kind of mild little thing, but tendonitis, just like the turf toe injury, there's a lot of different severity. It's a hard injury sometimes to treat because the tendons don't have a good blood supply. I tell patients all the time, if you ever look at a piece of steak, you have this red piece of meat, but a portion of it starts to turn white. Well, that's the tendon because of poor blood supply. So that lack of blood supply can make these injuries hard to heal. So it's a weird problem that has a lot of variability, and we've definitely been talking about tendinopathy lately.
Yeah, Doc. I know we're not talking about anybody specific, but y'all did a really good job of replacing Nuss's leg when it fell off a couple weeks ago. Really good job. That surgery was quick. He was on the field, so good job.
Yeah, and proud to be a part of that.
Proud to be a part of it for sure. Really good job. Good stitching. So I've just been curious over the last couple of years. I felt like I went the first, let's just say 35 years of my life, maybe saw one athlete tear an Achilles tendon. It seems like there's 10 a year now. Like,
true.
Why is it just something that wasn't diagnosed in the past? It's better diagnosis of it. Was it called something different back in the day? But why is there so many Achilles injuries right now in sports?
It's interesting. There does seem to be more. I don't know for sure if there is or if it's just something we're more aware of. That's always one of the questions. And there is a lot of speculation. Part of it is surface. We always talk about grass versus turf. Could that play into it?
True.
I'm not saying it does or doesn't, but it's something that comes up a lot in our discussions. And then I think part of it too, you have guys that are bigger and faster and stronger. I mean, I swear every year I see these guys coming in, and maybe it's just because I'm getting older and smaller, but they look bigger and faster and stronger every year. And the thing is, it's all about physics. You put so much load on any structure, eventually you're going to reach that peak. So if we're talking about bigger and faster and more explosion, sports have become more year-round. If we look at sports right now, they're training more and more, and while that might make them bigger, faster, stronger, it's more wear and tear as well. So I think it's probably all those things.
I don't know if Kirk Cousins fits that mold, though. Or Aaron Rodgers, for that matter.
It's fair. Well, it was turf, though. So
it was turf. You're right. It's
I
interesting. It's wild, though. It's like
turf.
I mean,
I do too.
we've talked the Achilles. It's so crazy how that is such a prevalent injury right now, everywhere, and I don't understand.
I don't ever remember hearing it when we were playing. I mean, teammates.
They're just high.
I don't remember a lot. And again, it's maybe that's just the memory thing not working as well. But I'm with you on that.